Hello and welcome to Gateways to Healing. I'm Scott McGuffey, a clinical hypnotherapist and your host. Gateways to Healing is a program where we look at how you can utilize complementary medicine with Western medical services. In this series of programs, we introduce, explain, and explore the 4 gateways to healing: mind, body, spirit, and community. Today we're going to look at the gateway of the body and body in motion. How moving our bodies through certain modalities can enhance our health and actually help in the healing process. To help me do that today are my guests from Integrated Healing Arts. And on my right is Dr. Marianne Ferda. Welcome back, Dr. Ferda. Marianne is a doctor of chiropractic who has a special affinity for body work. In addition to using traditional chiropractic techniques in her practice, she employs a wide variety of soft tissue techniques to assist in the rebalancing of the systems of the body. Taking literally the role of doctor as teacher, she teaches not only her patients, but students at Palmer College, De Anza College, and the Body Therapy Center, and has an ongoing yoga class in Palo Alto as well. Also with us today is Karen Andy. She has a master's in physical therapy from Stanford University and is a certified Feldenkrais practitioner. Karen has a private practice in Palo Alto where she helps individuals regain lost physical awareness and facilitates the physical healing process with Feldenkrais method. Karen also has a strong interest in the arts, especially music and acting. And last but not least is Joe Deischer. Joe is an instructor of Tai Chi and Qigong. He has been studying and practicing Tai Chi and Qigong for 32 years. He spent 6 years in Japan.
8 years.
8 years. 8 years in Japan. Can't give that up. Studying all sorts of things like Go, Aikido, Tai Chi Chuan, the Japanese language, astrology, and brush painting. And I also want to mention that Joe teaches all up and down the peninsula from San Francisco all the way down to Saratoga.
Yeah.
And let's go ahead and just jump into the first topic here today. As we re-enter the gateway of the body and look at the healing process of having the body in motion. We have all heard that exercise is crucial to our health, and it seems that our bodies were meant to be active in our lives. Through that activity, our body rewards us with a life which is healthy, strong, more flexible, and we have the greater possibility of living longer. And I'm reminded of one of my favorite quotes by William Blake that says, "We as humans are like trees, except we have legs and we can walk." And I think that there's some fundamental nature there that we are creatures in motion. So my first question is to you, Dr. Ferda. What role does movement play in our health and healing process?
Well, when we talk about movement, we're probably, for the most part, thinking initially of the musculoskeletal system. And, you know, the expression, if you don't use it, you lose it, is very true. If we don't move our bodies through a range of motion, the muscles tighten up, the joints close down. But when we're talking about movement, we're talking really much about all of the systems of the body. So not only the musculoskeletal system, but the cardiac system, the vascular system, the nervous system, the internal organs, the GI tract. So all of the systems, we're designed to move. We're not meant to be static.
Mm-hmm.
You know, Scott, I'd like to jump in. Your quote there about trees walking around and that kind of stuff. Somebody suggested that animals are Mother Nature's way of getting some motion out on dry land.
Oh, very nice.
And what movement does is keep things circulating.
Uh-huh.
And especially blood, but lymph and oxygen and possibly even prana or chi energies and such. And that provides oxygen, stimulates the metabolism, carries away waste, brings in food, provides for rebuilding materials. So in a very central way, it seems like movement stimulates circulation.
Let me just ask you, go ahead, Karen.
Yeah, I mean, just a slightly different face on it. I mean, movement is also part of our just vocabulary of expressing ourselves. And so if I'm talking to you and, say, trying to convince you of something, how you receive that's going to be very much affected by my posture. So if I really believe in something, but I'm looking at you like this and trying to discuss it, it's going to be a little less believable than if I'm sitting in a way where I can get my spine behind what I'm trying to communicate. And so I think another way that movement movement flows into general overall health is if you move with clarity and integrity and have your emotions, you know, it's all there, then people are much more likely to, you know, the communication is going to be better with people. And the feedback you get from people around you is going to be more clear.
So we're not just talking about physical healing, but it seems like we're branching out now, and I wanted to get back to Joe in a minute about something he brought up, but it sounds like it is more of a holistic healing, that you're incorporating the mind, the body, the spirit, I imagine even the community.
Absolutely.
Right.
Joe, I just wanted to come back to what you had mentioned. You'd mentioned prana and chi energy. Can you just briefly tell us what that is?
Probably the best analog for that for us Western folks is electricity, body electricity. And people know a little bit about EKGs, electrocardiograms, and EEGs. There's also electromyographic studies, muscle activity. And it looks as though you can't do chemistry without doing electricity. And it's been ignored. And it's possible that that's actually perceived. And there have been some studies that show that the acupuncture points, which are related to the chi function, and it looks as though that hooks into some of the nadis out of the yogic tradition and that sort of thing. They seem to be electrically peculiar places on the surface of the body that reflect the chemical activity of the organs within.
So what are we doing wrong? I mean, we look at Western America, Western United States, the Western world, and we see that our health is not that great. As a matter of fact, reading reports all the time that it's declining. How does that work with motion? Marianne?
Well, we have all of these labor-saving devices so that we don't have to wash our clothes. We put them in a washing machine. We don't need to, I mean, the difference in just the incidence of repetitive stress injuries. We don't even, I mean, even when we had typewriters, you type, 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 you get to the end of the line, you move the carriage, you take the piece of paper out, you move it in. Now we can spend hours with minimal motion. So we've come up with all these technological advances to decrease the necessity of engaging our bodies in the process of living. And I think we're finally getting to the point where, you know, you can just be static and communicate by mind, but we're realizing finally with repetitive stress and all that we are much less alive. So labor saving is labor creating for in the
That brings up a whole social perspective on it. The society hasn't set itself up to value movement and physical activity so much. But you were about to leave.
Yeah, I was. Really, when we think of exercise, you know, that kind of thing, a lot of people think of it as something they should do, and, you know, for their health or whatever reason. And what we've taken out of it is we've taken the joy out of it. You know, we've taken the vitality out of it. I mean, movement is a wonderful thing to do. And if you move in certain ways, in certain environments like Marianne was talking about, where the environment limits you, you know, there's not much you can do really in front of a computer. Then you just lose the ability to say, you know, pick an apple out of a tree. You lose the ability to extend. There's a whole range of things that we don't explore anymore. And so loss of that, with the loss of the pleasure in movement, I think is a big part of it.
I really liked your earlier point, too, about the emotional expressiveness of movement. And sometimes you catch just a glimpse of a person, you know exactly who they are, and you can practically tell what their mood is by the character of their movement. And I have a hard time writing, and to even think that this kind of nuance can come out in language is stretching it.
Yeah.
So we brought up an important point about exercise, and now we all know that in the late 70s, especially in the 80s, there was just a big boom. I mean, even here in Silicon Valley, major corporations have exercise equipment in their business, place of business. But I have a feeling that what you three are talking about goes a little bit beyond that. And I think I just want to actually ask a leading question. How is what you do different than exercise? How is that more healing in as we touched on, a holistic way? And yoga, Marianne, why don't you tell us a little bit about yoga and how that works in difference to exercise?
Okay. Well, it's not done with a goal in mind. You're not trying to. We've been talking about this before. It's not about getting the basket in the hoop. And I think that sometimes when people come to yoga, and I have to diverge for just a minute here and say that what I'm talking about is hatha yoga, which is the yoga of the body. There are 8 limbs are described of yoga, and so as yoga is a complete system, we're not only talking about the movement of the musculoskeletal system, but the movement of energy through the body, the movement of the breath. There is a limb of yoga which is the yoga of good works. So when I'm talking yoga in the context of movement, I'm talking about hatha, which is the asana, or the movement through the musculoskeletal system and the internal organs, but basically the movement of the body as that yoga. And so what was the question?
How is that different than, say, I just want to go down and pump weight at the gym?
Okay.
What is the difference?
Okay, so part of the difference is goal-oriented. You're not lifting X number of pounds, and you don't have to do so many repetitions, and there isn't a competition. That's a challenge for a lot of people beginning yoga if they're accustomed to doing sort of more standard, weightlifting or some kind of dance movement, sports-based or even dance-based, where the goal is to can you straighten your legs and get your head your knees above your nose.
Right.
That it's part of what is intrinsic is gaining a greater sense of yourself. And so there's an internal aspect, and it's possible, we had this discussion previously, it's possible for some folks that do lift weights can become a meditation because they're moving into that internal space. And so I think that's a difference for all of what we do.
I'd like to step in there with the language of associative versus dissociative exercise.
Exactly.
And if you're in your body, if you're in the vehicle, if you're in the means, because from that point of view, then, even these exercises are goal-oriented, but they're not goal-oriented at the expense of the means. That is to say, one stays mindful of the means by which, even if one is, in fact, somewhat goal-oriented or has goals. Tricky language. You want to do
right.
You want to do
yeah.
in
In Feldenkrais's work, you think a lot about awareness. And you think about learning and efficiency of movement. So those are really big goals. So say someone comes to me with repetitive stress problems, you look at how they really feel in their body. When they face the computer, where are they holding their pelvis? Where are they holding their chest? Do they have a clue? Usually they don't, or they wouldn't be in my office, okay? So, part of, I don't exercise with people at all, but I do teach them things like, if you move your pelvis forward, let's try to feel what happens to the thoracic spine, to the chest. Can it open out? And so you really want to get people to be more aware of what they're doing so they can do what they want to do safely and effectively.
Yeah. And let's go to Joe. We have some tape of Joe doing some Tai Chi, and we'll go ahead and just play that now. And Joe, if you can just talk about, as we show the tape, and you can see the very fluid movement. And when I looked at the tape earlier with you, my first impression is that there is no goal, but there is a certain amount of purpose. What is the purpose behind that?
The purpose is to really move with the energy. And this gives a sense of wholeness of movement, so that one's attention, which is a sort of a spiritual function, and one's energy and one's physical being are really working together at something and not working in different directions. This plays right directly into that notion of associative exercise. So in the beginning especially, because by and large adults have kind of lost their integrity. We all live rather fragmented lives in many ways. People go slowly to take the time to get the attention and feel the energy and go with the movement. And so it starts slow. On the other hand, it's martial arts, and so it ends up moving fast.
Yeah.
But by then, hopefully, there's been a synthesis, a reintegration. And so the purpose of doing it slow, and if you can, you choose nice environments, and certainly an environment where your distractions are minimal, so that you can pay attention to what you're doing. As you mentioned, a weightlifter can do this. A person who is deep in an internal asana does something like this. A person who is really following Feldenkrais's instructions is deep in an awareness of how they're doing what they're doing. I'm told that people who do dissociative running never get to be world class because they're not in the equipment. And if you're not in the equipment, you're at a disadvantage with respect to somebody who is actually embodying themselves.
So to kind of go back what Marianne was talking about, we're living in a society where we have reduced movement, And along with that, we have possibly lost the opportunity of working with our bodies to go into an internal awareness. I keep hearing all of you say breath and awareness, breath and awareness. Obviously, the breathing is very important to that, but also I think what you were talking about, Joe, it's a little bit more than introspection.
Yes.
It's about coming into yourself and, like what you were saying, Karen.
Kinesthetic awareness.
Thank you. Kinesthetic awareness. Let me just ask you, Karen, how have some of your clients worked with you to gain a better understanding of their healing process, working with what you do in Feldenkrais method?
I can give you an example. I had a patient who is a dancer, and he had had 2 years of pretty severe back pain before he came to see me. He actually injured his spine about 10 years previously, had a surgery, which worked for him for a while, and then it didn't work anymore. But he loved to dance. He and his wife did it about 3 times a week, or tried to. But he was really miserable. He was barely able to do it at all. So I put him down on the mat and noticed that when he was lying on his back with his hips and knees bent, feet on the mat, he didn't have any idea really. His feet didn't have any idea of where the ground was. It's like, and his foot on the ground and his knee was kind of over here. And he didn't have a clear understanding of how his foot contacted the floor. And so when you dance, then your weight just gets distributed all wackily, and he hurt his back every time he tried to move that way. So we worked on that. We worked on integration, really, integration of awareness and feeling and moving. So he moved a lot more skeletally. His pain disappeared. He's dancing 3 times a week, so he's fine.
And Marianne, with yoga, we were talking earlier about how surprised people are when they come into yoga. And what are some of the things that your clients learn through that process?
Yeah, it's a sense of awareness of self, and the introspection that's possible, and just the refinement of movement in the context of an asana, moving through an asana or a sequence of postures, following the details of the movement. And so again, in the beginning of the process, I think it's very clarifying for the mind, because there's so many aspects of paying attention to the details of the body that when you finish a yoga class, you've been completely focused on the body and the way that your body moves, and thinking about it, and making new discoveries about how, when I move my little toe, if I put more weight on my little toe, the knee pain that I have goes away because because of that. And so sometimes really stunning things like that. And then the end of the class, you lie in Shavasana, which is corpse pose, which is basically as comfortably as you can be lying on your back and in quiet. And there's often floods of awarenesses, not only about the body, but about what's been going on emotionally or psychologically with an individual. And that kind of clarity that comes with that moment of introspection. And there's also aspects, I think, of the support of, it's almost like it's a moving meditation that's done in a group.
Yeah, I was going to say, this sounds a lot like hypnosis sitting over here. But yeah, there is the meditation, the focus, and the awareness. Which just reminded me of something this past weekend in the Parade magazine, which we get in the Sunday paper. The very last article, a doctor had written a book on aging. And I thought it would be good to bring up with this group, because they had mentioned how movement really helps with people who are perhaps disabled, in senior care, that type of thing. And they're just noticing, they mentioned Tai Chi Chuan and yoga as an example. What are some of the things, Joe, with the clients that you work with, the students that you work with, it seems to me that, I'm never going to be a weightlifter, at least I can't imagine myself being a weightlifter past, at this point, maybe 40. But we notice that the Tai Chi and the yoga, and certainly Feldenkrais method, is something that can be a lifelong process.
Right.
And that was one of the things they were talking about the article, is that when you begin the study of Tai Chi or yoga, that it can go right up to the very end. Have you had clients like that you've noticed taking off?
I've worked with some elders, and it's trippy to work with people who've got 80, 90 years of background to bring to bear on it. But there's a sort of a process of discovering that just being a physical creature doing a job isn't very satisfying. Or it causes pain, and people discover that there's something they can do to change that. They frequently discover their energy body, if you will. And then they discover that they can do something with that themselves, whether it's through yoga or through Feldenkrais work, or there are many other modalities. Then the thing is, many of these are in some sense a little bit like calisthenics. Although they've got a meditative aspect, they're somewhat repetitive. To be able to move on into dance, and in fact, I think one of the longest-lived professional groups are conductors, orchestral conductors.
Right.
Oh, yeah.
Because they move rhythmically, they move sometimes very fast, but there's a tremendous entirety in the movement. So dancing is a really good way to move on into the future with this. Tai Chi Chuan is interesting. It's called shadow boxing sometimes. It's largely seen as doing it by oneself, but you can do it in doubles also. And in the process, and this doesn't have to be done as a vigorous, violent kind of martial art, but it's a dance. It's kind of like kinesthetic chess in a certain way.
Yeah.
That's a great way of
really
describing it.
Yeah.
Yeah.
Really interesting when you get
And I
into
just
it
got
that
the
way.
image of the No theater in Japan, or the
Yes.
Kabuki theater.
Yes.
You know, just a wonderful dance and orchestration that takes place.
Done with intense presence.
Mm-hmm.
And this gets into sometimes being intensely aware of another person in the relationship, to the point where the level of focus goes way up, as you were just speaking of. And then when you come back from it, it's like having your mind washed. And you say, oh, well, let's see, oh yeah, there's the whole rest of my life. Now, what do I want to pick up and what do I not want to pick up? You know?
Yeah, there's a clarity and a freshness and a renewal that happens that you know, I mean, I danced for years and I never, you know, I mean, you'd finish a movement and you were all stretched out, but there wasn't a sense of renewal of spirit in the same way.
Another way that it connects in specifically maybe toward Feldenkrais is part of the Feldenkrais work is teaching movement classes, which you can do for elder citizens as well as anybody. And a lot of the classes are really, or movement sequences, are based on developmental sequences. So you look at a child move, like a 2-year-old move, and they do all sorts of things with their trunk and their pelvis that, people as they age, it kind of drops out of the movement vocabulary again. Well, these lessons are designed to for re-entry, basically. So people have a lot of fun, learning how to move their shoulders again, or their breastbone, or their pelvis, and moving in opposition. Sometimes people, when they get older, they walk in a way that the pelvis doesn't move and the shoulders don't move, and so it's a very rigid kind of thing. Well, after a Feldenkrais lesson, that doesn't happen so much anymore. You get much more of the diagonal, natural movement.
And this might be a good point to look at how what you people do with teaching the body and the holistic awareness and the breathing and everything else, and how that works with Western medicine. And we're seeing a lot more. Matter of fact, I was reading there are numerous clinics and hospitals now who offer Tai Chi classes. I know Feldenkrais is available, yoga classes. What has been some of your experience, Dr. Furta, with working with people who are in the healing process and working with Western medicine?
Well, again, it can move through all ends of the spectrum. I was just thinking of a patient that I was working with a while ago who had breast cancer. And they had surgery and reconstruction, and so in the initial phase, there's issues of getting the tissue moving again once the basic healing has happened, so that you're sure you're not going to rip up sutures and tear up the tissue, but to introduce the movement in a way that's gentle, in a way that is inviting to the person. So. Restoring the balance. Obviously, if the surgery is done on one side, there's all of this closure and all of this protection. So again, it's a movement to allow for more movement of the tissues and the fluids, as Joe was saying, and particularly with breast cancer, if there's involvement of the lymphatic system, you need to help to move the lymph through the body, which is not even mentioning the psychological aspects, the fear, that stays in the cellular memory. So inviting the process of it's possible to move there, and it's possible to move there without pain. And so understanding where the limits of pain are and where the limits of, so that there can be once again pleasure in an area of the body that's been sick and protected and experienced a lot of pain. So all of that is part of what happens. And a lot of this that I think we're verbalizing isn't something that I verbalize with a person when I'm working with them. I'll talk, you know, we'll talk about, you know, just trying to stretch, take the arm up the wall and just see how far up the wall it will go, you know. And if you take a breath and you take a breath in, can you move up a little bit more? And how does that feel, and is that okay? You know, and just and wherever it is, and some days it's more and some days it's not so far, but it's not a race to the finish line. It's an experience of being in your body and how that feels and how that works.
So it's really about going from the point of trauma, whatever that is, to being dysfunctional, to being functional,
Right.
and then to move into a higher function. Joe, you wanted to add something there?
I wanted to step in with the elder situation, because one of the things that's real typical problem for folks who have got some decades behind them is balance. And they found, they did a study, I think back in the southwest Georgia perhaps, where they looked at nothing, some conventional exercises and some Tai Chi, and they found that not only did the Tai Chi folks' balance improve significantly more, but it stayed longer. Because there's so much attention paid to where one is in one's body, to how one's feet feel on the floor, and this is a core topic because all three of us have come up with it.
And that's another thing too, because it's not just a rote movement. You're not repetitively doing the same thing. You're focusing on what you're doing and how it's feeling, and so it gets integrated into the cellular memory as well as into the cerebellum and the motor cortex and all of those places.
Yeah, and the nervous system. Because, you know, like just to go back to your breast cancer example, if you're reaching up, you know, after surgery. In Feldenkrais, we talk too about, well, can you feel what your ribs are doing? You know, can you breathe into the area? If you shift your weight to the side of the arm, does that help the movement? Does that help the movement happen? In physical therapy, often there's a real emphasis on looking at a joint. You know, looking at a problem as a joint. Well, this person has after surgery a tight shoulder. Well, you really have to look at how it's all put together.
Yeah.
You know. And that's really terribly important, and it's something that Feldenkrais does a little bit differently than, say, a physical therapist might.
Right.
In general, recovering from trauma, you need tissue healing, but then you've got to go back and heal something else. Because, as Marianne was saying, when there's been physical trauma, there's been pain in an area, and we tend to withdraw our attention from pain.
Right.
But then the attention isn't in the tissues anymore, and when the attention is out of the tissues, then the energy isn't in the tissues and the blood flow isn't. So there's something that happens after recovery from trauma that Western medicine has tended to leave out. So sometimes you'll see people who broke an ankle when they were 12 and at age 42 they're still limping,
Yeah.
sort of thing. You really want to jump in on that one.
Well,
We just
we're
have
almost
about
out
a
of time.
minute.
Yeah,
So.
go ahead.
Oh, go ahead. Did you want to add something?
No.
Okay. Very good.
He said it all.
Yeah, well, it's been very enlightening, and I certainly now have a better understanding about just the body in motion, and that I think as we started off with just the refined movements, the carpal tunnel that we're seeing, and also the awareness. I mean, a lot of what I do in my hypnotherapy practice, I'm constantly referring people, okay, now that you have a sense of awareness, let's get the body in motion, and it really is a nice healing process. I want to thank you all for being here today. Dr. Marianne Ferda,
Thank you, Scott.
and Karen Andy, and Joe Deischer, Tai Chi instructor.
Thank you, Scott.
Extraordinaire. And that's about it for today, and Gateways to Healing the Body in Motion. In our next program, if I can remember what it is, there it is, we're going to talk about what we put into our body and how what we put into our body can be a healing process and a natural process. So I hope you join us then, and until then, here's to your health.